You were inside the Mayo Clinic hospital system in Wisconsin for a couple of days. I read it twice. It was the kind of story I read out loud to anybody who would listen. But just talk about what you saw.
Thanks for having me. Yeah, we were allowed to go inside for 2 days to a medium-sized hospital in Eau Claire, Wisconsin. And what we saw was the tremendous strain, the tremendous stress that doctors and nurses and other personnel are under. COVID patients are filling an increasing number of the beds in there. The system, which is one big hospital and 4 very small ones, has been operating at capacity or over capacity for many weeks now, and you can see the toll it takes. Everybody is operating at 120% of what they're able to do. Then they go home, and they have to deal with their own families who are also under stress.
I spent some time in Eau Claire after the 2016 election, and I got a lump in my throat when you were writing about the kind of people that came in the hospital, proud, hardworking, some dairy farmers, I think, were described in your piece. But none broke my heart more than the nurse who sat with a COVID patient for their dying words and breath, and then had to get up and rush to sit with another one while he died. Talk about what the nurses and doctors are feeling right now today.
Well, the nurse that you're describing had just come on shift. She'd been there just for a short time, and another nurse had to do something. So she said to this Mary Beth Pickler, would you mind sitting with this COVID patient? He's an elderly man. He has perhaps an hour left to live. And she did, and she just sat there and spoke with him. He talked about his dairy farm. He talked about his Angus cows that he had. And then after a while, the oxygen mask was uncomfortable for him, and he took it off, and he quickly passed away. He's not allowed to have visitors. He dies without his family. He dies with a nurse holding his hand. And we see this again and again and again throughout this pandemic. That is taking its toll on America's medical personnel. I don't care how you feel about masks. I don't care how you feel about what is true and what isn't true. It is undeniable that after 8 or 9 months of dealing with this pandemic, our medical personnel in the hospitals are burned out, exhausted, and need some help.
Dr. Patel, your thoughts to all of this?
No, I can't agree more with your and Lenny's. And I want to thank Lenny because that it's not often you can have access inside of a hospital, and you really do have to see those emotionally raw moments. And I practice in a clinic setting, not in a hospital. So even my friends that are in clinics with COVID patients like we are don't see what you just expressed beautifully, Lenny. And I think that, just to be candid, to bring it back to kind of where we are, you know, Dr. Atlas did more damage in 130 days than you could possibly imagine. And it's being reflected in what Lenny described. We've got people who, even as they're dying in the hospital wards, don't necessarily agree that we should wear masks, for example. And that does take its toll, not just on medical workers, it takes its toll on the people driving buses, people operating machinery, the people delivering our mail. It takes its toll on everyone.
Dr. Patel, I don't know if this is right or not, but my feeling right now is that there's more COVID out there than at any other point, and I feel more scared. And I've always worn my mask, but I've also always gone to the grocery store. I've always gone to Walmart. What should and should not people be doing right now in their own lives? And is feeling scared, is that right? Is that irrational?
No, it's not irrational, Nicolle. I think feeling scared is totally normal. Look, if it helps to hear it out loud, I'm scared too. And I'm scared because I've got little kids. I've got elderly parents that I haven't visited in a year, and I worry that I'm not going to be able to see them if they get sick. But here's what I want to tell you. I think we need to turn that fear and that kind of feeling of doom, turn that into something proactive. If, only 70% of Americans wore masks, then we could actually kind of flatten this curve. So when you think about Walmart or when you think about the grocery store, just be incredibly vigilant about your surroundings. You are right, Nicolle. We are seeing patients who have sworn up and down to me that they have not been out of their home and they do wear masks and they're positive. But that just tells you how it's called viral spread for a reason. And I want people to hear that they can take measures, but you must be vigilant. And here's something I'll share with you. In medicine, the doctors I work with every day, we actually go into the medical room, clinic, and hospital, assuming everyone has COVID. And I don't want you to act paranoid, but I want you to kind of think that way, Nicolle. You know, just take notice of your actions as if people around you had COVID. That might make you a little more vigilant, but acknowledge your fear and then turn that into something that you can actually use to kind of help flatten the curve. It's the only way it's going to happen if we all do it together.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.